Let's head straight into the news, and in our first story, the Ghana Medical Association has called out its own members over rising cases of sexual harassment of patients. The GMA also reveals that a chunk of doctors are also involved in alcoholism and drug abuse. President of the Ghana Medical Association, Dr. Frank Serebour, raised these concerns at the 66th GMA Annual General Meeting, revealing that most victims, unfortunately, gave up on the prosecution of these cases of sexual harassment.
We have some health personnel who are involved in alcoholism, drug misuse, and abuse, which affect the quality of their lives. There has been, in extreme circumstances, reported cases of sexual harassment perpetrated by health workers. And yesterday, the Medical and Dental Council Registrar, Dr. Divine Bayubala, told us that there are a lot of pending cases of sexual harassment even before the council. We have had cases where doctors have been badly discussed on radio shows and other media outlets. There have been several legal suits against health facilities, with the outcomes not being favorable to us as health workers. Indeed, sometimes we are left off the hook simply because the victims of our unprofessionalism choose to blame the witches and the wizards, as well as the fearful, for their predicament instead of taking on the system. So when we pray, we should pray for the witches and wizards. They are saving us. Ladies and gentlemen, professionalism should be our silent companion. It has to walk with us through our journey of working life. It should always manifest at every opportunity. I know I have painted a grey picture, but let us fortify our spirits against despair with curious agility and also balance our ambitions with acceptance. This will make us truly self-sufficient and grant us eternal freedom.
But these are not the only concerns of the GMA. Dr. Serebour also called a lack of commitment to the job, especially among junior doctors.
Let me ask, is professionalism in the health sector dwindling? Is there so much focus on greed and selfishness? Is there a lack of respect for colleagues and subordinates? Recently, the junior doctors are holding various forum or fora, and they are indicating that we are bullying them. Is it true? But at least all of us can attest to the escalation of lateness to duty, absenteeism, poor documentation, and also not dedicating enough time to our employers. People walk into the hospital at 9, by 12, they are walking out. You ask them, they say they are done. And yet they expect to be paid for working 8 hours at least in a day.
Now, advocacy think tank CDD Ghana is asking the Electoral Commission to resort to what they call proactive disclosure of information as part of efforts to ensure electoral justice. Now, with 25 days to the December polls, political parties, marginalized groups, and some individuals have raised concerns about the frequency, adequacy, and means of information disseminated by the EC. Delivering the keynote address at a public forum on access to information and elections, Director of Advocacy and Policy Engagement at the CDD, Kojo Asante, recommended to the EC the use of varying channels to disseminate information so the electorate would be adequately informed.
I want to start, first of all, with the EC website. I really wish there could be more that we can put on the EC website. It's going to become the focus of attention regardless because of election activities. And election day, of course, because of results. The EC has committed to publishing polling station results on this website, so that will be. But I think that it just in terms of voter and civic education, there's a lot that the EC website can do, but not in text format. As I was asking people where they get their information from. If it's not on what they call Snapchat or any of these things. So how is the EC reaching out in terms of its civic education? Because the statistics I just gave.
Now, the Director of Training at the EC, Dr. Srebo Kweku, has asked citizens to also play their part by visiting the EC's website for updates, especially as the general elections approach.
Please let us also be proactive, because I don't know, there were a lot of adverts. Those people in the media will tell you, we advertise, and so if you didn't hear, that means that maybe you are so busy at your work schedule. But once in a while, please once in a while get time for the media. With respect with the timetable, we came with the timetable since February, and it has circulated a lot. It has circulated a lot. So the issue is that there's no way we can be targeting the individuals that maybe you have to come to your house. It's not possible. So once in a while, the general one that will be sharing, and with the support of the media, they will be. So no matter how busy you are, once in a while, listen to the news, and it will be done.
And the Center for Water, Sanitation and Hygiene, a non-governmental organization, has donated solar-powered mechanized water systems to 2 senior high schools in the Upper East region to relieve the students of the challenges of access to water and promote good sanitation in the schools. Correspondent Albert Sori reports.
The beneficiary schools are the St. John's Integrated Senior High School in Navrongo and the Azem Namwa Senior High Technical School in the Bongo district. Until now, the lack of water at St. John's Integrated Senior High School, which has a student population of over 1,500, significantly hampered teaching and learning and the overall well-being of the students. Similarly, at the Azem Namwa Senior High and Technical School, students and staff said life on campus was very difficult due to the insufficient water supply. This school has a population of nearly 800 students and 40 staff members who all struggled to get water for their daily activities on campus.
We always suffer a lot to get water in campus. Sometimes we go outside the campus to fetch water, but outside there, they always harassed us with the girls. So it is always difficult for us to get water, to be able to go to class early, preps, and do other activities.
We depend on only one borehole, which sometimes got spoiled. We have to go outside and get water, which prevents us from our daily activities.
Help has, however, arrived as the Center for Water, Sanitation and Hygiene, C-WASH, a non-governmental organization, has donated solar-powered mechanized water systems to the 2 senior high schools. Each water system features a 3,000-liter water storage tank to ensure the availability of safe drinking water. The donation is part of the Wash in Senior High Schools project implemented with funding support from the NSPEAR Foundation. The initiative aims to enhance the health and well-being of students and staff while fostering a conducive learning environment. Samuel Volashi is the project manager for the Center for Water, Sanitation and Hygiene.
This school has no water at all. The toilet facilities, they have some, but they cannot use it. We did a baseline assessment, what we got from them, some don't even bath because the water is not there. It's hampering the teaching and learning. It makes them come to class late. The girls, when they are in their menses, it's difficult for them to take care of themselves. And some even stay in the dormitory. And looking at this, we decided to just come in and then support them with the sponsorship of NSPEAR Foundation of Switzerland. And we're going to rehabilitate all the toilet facilities for them as well, so that they can be able to use the toilet facilities, and then we end open defecation.
The students and administration of the 2 schools were grateful for the gesture. Ebenezer Tay is the headmaster of the Azem Namwa Senior High and Technical School.
This project will give us water 24 hours a day. Students will not have to go outside to look for water. They will be in their dormitories, and water will flow through the dormitories and they will fetch. And we hope this will reduce our time that is lost previously looking for water and will improve our instructional hours. We have formed a committee, the WASH committee. They will be going around inspecting facilities. Anytime there's a problem, they will report to management for management to take action.
For Joy News, Albert Sorry, Bongo.
Welcome to our business updates. In our first story, economist Professor Patrick Esuming has challenged government to harness its untapped resources to generate revenue domestically to refinance its longer-term development plans without relying on external donors. His call follows a warning by the French government saying it is now cautious in the manner in which it lends long-term loans to Ghana. Reacting to the development, Professor Esuming stated that it was about time Ghana looked within to finance its own projects.
It's important that, when it comes down to how to interpret, being cautious, you get a sense that it means that, there probably isn't going to be much coming. Now, I think that will increase the funding gap. Don't forget that in the current program that we are in with the IMF, we can only get concessionary loans. If you are non-concessionary loans, there are restrictions. So if those sources, there are hints that those sources are going to be limited, then it means that we have to think long and hard about long-term financing. But I think that is something that we should be doing anyway. We know that we cannot continue to depend on external funding for our development. It's something that should have been obvious to us anyway. It is just a confirmation of maybe something that we have been reflecting on. So it's now time for us to look within. And let's face it, there are many opportunities for Ghana to raise resources domestically for its development. There's so much untapped potential. So while it seems a little troubling to hear, it should also hint to us that now we have to put our house in order and look within to finance our longer-term development.
Let's now take our currency market for today. That's it for the AM News. The AM News Review is up next. We are joined by Kojo Poku, an energy analyst, and Wisdom Dogbe, a financial analyst. We'll be right back.